Good evening friends. Today we are going to discuss a question about diabetes and the drugs. So here is a 64-year-old woman is brought to the emergency department due to confusion and lethargy. So we have to see this. This is a USMLE pattern question, but the topic is very important for NEET and INSET. As nowadays they are asking more of drugs related to diabetes. So we are focusing on more on that. Okay, see, we have to know all the mechanism of action of this anti-diabetic drugs compulsorily, so that we can answer this question. Okay, we have to see the buzzwords in this. Let's see. 64-year-old woman brought to the emergency department, confusion and lethargy. She is confusion and lethargy. The patient was asymptomatic before, but now it has the confusion and lethargy is there. Medical conditions are like type 2 diabetes mellitus and hypertension, for which she is taking multiple medications. All other parameters are normal, vitals are normal. On physical examination, the patient is somnolent but withdrawals all the extremities to the pain. Laboratory test shows this elevated serum PAC peptide levels. This is a very important buzzword in this question. Okay. Now, if her current condition is due to the anti-diabetic drug, which of the following is most likely the culprit agent in this? Okay, the options are acarbose, canagliflozin, glyburide, long-acting insulin, metformin, pioglitazone. See, what is serum C-peptide levels indicates? First thing is, only the endogenous insulin, if it is produced, then only the serum C-peptide levels can be increased. How is it? Because first, the insulin production, how it starts is pre-pro-insulin. There will be pre-pro-insulin. This pre-pro-insulin is converted into pro-insulin. This pro-insulin is converted into insulin by releasing C-peptide level. If you want the structure also, you can see, if this is insulin, this is the pre-insulin which have the C-peptide level. This is a pro-insulin, after which it will detaches and only the insulin will be formed. Insulin will be formed. Okay, that is insulin. So if you are giving exogenous insulin, there won't be any C-peptide levels will be increased, because exogenous insulin does not have this C-peptide. We are giving insulin directly. This insulin we are giving exogenously. But if endogenously the insulin is produced, then only the C-peptide levels in the serum can be increased. So this long-acting insulin is ruled out. We are not giving any insulin. It is not because of the elevated serum C-peptide levels is not because of this long-acting insulin. So okay, this is ruled out. Then most of the people marked metformin. I don't know why. Metformin is insulin resistance. It decreases the insulin resistance so that the insulin is utilized to the body, and then there will be decrease in the insulin. There will be increase in the utilization of the insulin, so that we decrease in the glucose levels in the body. That is its mechanism of action. So this is also not an answer for this question. Here the patient having the features of hypoglycemic features, right? The patient have hypoglycemia. Which is the drug which causes the hypoglycemia? More drugs. The drugs which causes hypoglycemia. What are the drugs which causes hypoglycemia? Most commonly, the drugs which cause the hypoglycemia are not because of decrease in the glucose levels. It is mainly per se because of increase in the insulin levels, or increased secretions. Insulin secretion. That is why the so much of insulin secreted, that's why hypoglycemia happens. Only per se by absorption or decrease in the glucose levels will not have the hypoglycemic features, right? Body will not allow that to do. Okay, this even acarbose will decreases the glucose absorption from the brush border cells of the intestinal cells, right? There's the inhibition of the alpha glucosidase enzyme that will delay the carbohydrate hydrolysis and causes also glucose absorption will be decreased. So this will be more useful in the postprandial hyperglycemia. So that is why it is used. So there won't be any hypoglycemic features, and also there won't be any C-peptide level rise. So this is also ruled out. Canagliflozones, what is the mechanism of actions of these glyphozones? The glyphozones mechanism of action is SGLT2 inhibitor. Yeah, we have read that. SGLT2 inhibitors, canagliflozone, dapagliflozone, empagliflozones, all these glyphozones belong to, very important question, glyphozones belong to SGLT2 inhibitor. Where is this SGLT2 present? It is present in the PCT, proximal convoluted tubule of the kidney. So what are the side effects of the glyphozones? There will be glycosuria, and UTI will be there because increase in the glucose secretion from the urine. So there will be increase in the glucose. Glucose is the main thing for bacteria to grow, right? So UTI will be the most common side effect, and also you have to use it with the caution in renal insufficiency patients. Okay, that is one thing. And also it causes weight loss. There are a lot of weight loss and weight gain, weight neutral drugs are there in the diabetic. One of them, this is glyphozones, causes weight loss, and weight neutral drugs are, what are the weight neutral drugs? Weight neutral drugs are gliptins. Yeah, linagliptin, saxagliptin. The most important is saxagliptin. And what are weight gain drugs, or what are the weight gain drugs? Yeah, sulfonylureas, mainly second generation sulfonylureas are weight gain caused by sulfonylureas. The drugs which causes hypoglycemia. What are the drugs which causes hypoglycemia? We can remember by this mnemonic, that is the drugs which ends by "ide", like meglitinides, sulfonylureas. There, what are the examples of sulfonylureas? Chlorpropamide, tolbutamide, right? These are first generation sulfonylureas. And the glipizide, glyburide, which is the answer for this question, glyburide, glipizide. And meglitinides are also other form of these are also act just like the sulfonylureas, like increase in the insulin secretion. So meglitinides, linetaglinide, trapaglinide, these are also ends with ides. These are all causes hypoglycemia. Here there is increase because of, why hypoglycemia is because of increase in insulin secretion. How insulin increased, secretion increased? This is the beta cells of a pancreas. There will be potassium channels. The potassium channels are blocked, so the cell get depolarized. After a cell is depolarized, the calcium is increases because calcium is not able to go out. So whenever the calcium is increased, the secretory vesicles are there, these insulin granules, this will get released to the tissue, blood. Okay, that's how increase in the insulin happens. So this is endogenous insulin secretion increases. That's why C-peptide levels are raised. Now tell me which is the answer for this. What is the answer for this question? Canagliflozones ruled out, pioglitazones ruled out, long-acting not, metformin is not an answer. So answer is glyburide, which is a yes, sulfonylurea, which is a second generation sulfonylurea, and it causes hypoglycemia, also weight gain. Other side effects of the sulfonylureas are it acts as a disulfiram like reaction. Okay, so today's answer is glyburide. And that's about it. For those who don't know about me, I'm Dr. Purnima, and I'm going to post every day a question which is a USMLE pattern, and but the question will be about previous year topic of a NEET and INSAT only, but the pattern will be in a USMLE, so that we can understand the topic and how to tackle the question also. In the coming videos, I'm going to give some previous year topics and questions as it is questions as well. I'll post some questions with along with that. Also I will tell you the topic before the next video so that you can read and come. For now, this is it. Thank you.